I get the flu shot because I don't want to be sick. It's miserable. I have rheumatoid arthritis. I have enough problems going on.
I am a recently retired respiratory therapist, and so I have seen the flu. So I always get the flu shot so I don't get the flu.
It's well worth getting the shot as a preventive measure. If there's a chance of the flu shot being even, 90% effective in preventing that, I'm all for it.
So flu is a very common term that people use to cover many different things. And most of us, when we speak of flu, we mean influenza. So when somebody has influenza, if they cough or sneeze, then those droplets are expelled into the air, and somebody sitting next to them, such as on mass transit or in school or in a theater, can get those droplets, inhale them, and they become infected.
My doctor always recommends getting a flu shot as a way of trying to minimize the chances of getting it. I fully believe in that because anything I can do to avoid getting the flu again, I'm all for it. A small shot, it's probably worth the benefits. I really can't remember the last time I had the flu. I just remember that it was not pleasant, and I like to avoid it if I can.
So it's very interesting because different parts of the world experience flu at different times, and it goes from east to west. So in California, peak season for us is usually January to February, but that's really important that you get your flu shot as soon as possible to prevent infection. The flu shot works by stimulating your immune system to make antibodies, which help fight off influenza. And even though it's not totally a complete match from year to year, your body, more often that you get the flu shot, builds on the immune system year after year after year.
Well, people do think you can get the flu from the flu shot, which you cannot. It's not a live virus. You're not going to get it from the flu shot. So really, there's no downside to it. The needle is teeny tiny small. You barely feel it when you get it, so why not?
Thank goodness for small needles.
I am with Dr. Martin, and to get the flu shot, I just have to go into her office. They just give me a quick little shot, and I'm out of the office in 10-15 minutes. There's no time. It's really very, very little pain. There's no problem to it. If anybody's on the fence about getting the flu shot, I would say it's very important. It's important for yourself, it's important for your friends and family, it's important for the community.
I do think flu shots are very important, and I encourage all my patients to get flu shots. I have a particular patient, Tom, who's had a stroke. He's recovered from it remarkably well. I'm so impressed with what he and his wife have done in terms of his rehab. But the last thing he needs to do is to get the flu, get sick, and end up in the hospital again.
We're both patients at Washington Hospital, especially after Tom's stroke. We know it very well and appreciate it. I've been getting flu shots since they were created.
And now that I've had the stroke, it's really important because I don't want to get sick at all.
Since I started having the flu shots, I think I've only had the flu twice. I mean, that's 20 years or however long they've been giving us the vaccine.
I don't want to miss any days at work. Now that I've had a stroke, I don't want to be sick because I don't want anybody to get it from me.
I usually tell my patients that if they think they have flu or influenza, that they should contact our office and be seen as soon as possible. Because in truth, if we get somebody started on the medications, a retroviral, they're going to get through this much faster and have fewer side effects, and therefore expose less people in their family or their coworkers.
Learn more about flu prevention at BayAreaHealthierTogether.com.